Well, according to the American Cancer Society, 1 out of 9 men will develop prostate cancer. And of course, technology has come so far now that the early detection is really possible, especially when you are working with a system called UroNav. Well, we're here at Singing River Health System and South Mississippi Urology talking to Dr. David Spencer. How are you? Surgeon and urologist, how are you?
Yes, sir. How are you? Thank you for having me, Jim.
Well, thank you for, I love coming to the different places with Singing River Health System and the centers that are involved, because they've always got new cool technology to look at.
Sure.
And to see, especially what you're doing for men and women that can help them to early detection of so many different things. Talk about this right now. I mean, who's at risk at developing prostate cancer?
Well, as you know, prostate cancer is probably one of the more common cancers that we see in men. 1 out of 9 men in their lifetime. And what UroNav helps to provide is it helps provide a way to diagnose these men earlier. Also, hopefully diagnose men with more aggressive disease rather than some of the men with less aggressive disease, and also help us to make treatment decisions for those patients.
Well, how common is prostate cancer?
Well, 1 in 9 men.
Yeah.
And so it's very common. I mean, unfortunately, I have prostate cancer in my family. And I think men all over everywhere either know someone who's had to deal with prostate cancer, or have had to deal with it themselves, or have a loved one who's had to deal with it.
If you have a loved one that has prostate cancer, is it important at a certain age to go ahead and get screened just in case?
Certainly, and I mean, that would certainly put somebody in a higher risk group, particularly if you have what we would consider kind of a first-degree relative. That would either be father, brother, or even a child for that matter that has prostate cancer. That puts you in a much higher risk category. A lot of those men, probably particularly if they're having any sort of lower urinary tract symptoms or blood in the urine, things like that, should consider screening maybe even in their 40s, all the way up until age 70 to 75, because that group of patients is going to be much higher risk than the average patient.
Now, if you, was it the PSA score or something like that? If it's a certain number, yeah, you should go ahead and get it checked out.
Right, and that PSA tends to trend up as men age normally. But we know just from looking at studies that there are certain benchmarks of numbers where once the PSA gets over that number, we need to strongly consider prostate cancer and consider a biopsy of the prostate.
Talk about UroNav, this brand, and why y'all have decided to use it here.
Right. Well, UroNav has been out now for the past couple of years, but it's been one of these things that's been in studies. And part of what's important about UroNav is that it helps us to find patients with clinically significant prostate cancers that may have been missed on previous biopsies. One of the other functions for it is that there are a certain subset of men who have prostate cancer that have a slow-growing type or a very low-risk prostate cancer. Sometimes we help to provide peace of mind that we're not missing a clinically significant prostate cancer or a prostate cancer that's either going to affect their quality of life or length of life, and UroNav helps with that. The way that it works is that we actually order an MRI of the prostate first.
Okay.
Okay, so the MRI of the prostate, that helps us to look for areas called regions of interest. And the radiologist over here, 2 of the radiologists have actually gone to extensive training to be able to read these closer, to be able to find these regions of interest. And then once we have the MRI images, they basically turn the patients back over to us, and then we work on doing an MRI ultrasound fusion biopsy of the prostate.
Now, when men go to get their yearly checkup, so to speak, and they get the really uncomfortable checkup, and the doctor feels something not out of the ordinary.
Right.
That's usually that's another way of saying, hey, you need to go get this done.
Exactly, and that may not necessarily lead to an MRI of the prostate, but certainly would warrant an evaluation by a urologist.
Now, talk more about this. I mean, you're combining MRI and ultrasound.
Correct.
Which normally you think about ultrasound, okay, you're checking a pregnant woman.
Right.
Something like that. You wouldn't think it'd have to do with the prostate.
Right. Well, the ultrasounds that we do, we right now do these in the office, and we do ultrasound guided biopsies in the office. And for some men, that can be very uncomfortable. Most guys do fine with it, but one of the goals of this is to avoid unneeded biopsies in the future. and also, like I said, make sure that we can reassure some men that they don't need further treatment.
Right, right. Can you give us an example of, you know, with
Sure.
how this is done?
And we actually have Kayla here. This is actually a case that we did a couple of weeks ago, but this is a patient, and what we're looking at here is once we got through, here is actually the region of interest that was found on MRI. This is actually showing where you can see we took 4 passes through this area. Once we did that, we actually did do a typical prostate biopsy based on that, but you can see how in 3D we can see exactly where this region of interest or this abnormality was in this gentleman. If you can go to the MRI images. So here's some of the MRI images, and you can see here's our region of interest that looks abnormal. This is kind of on the left lateral aspect or the peripheral zone in the prostate. Some of these areas are typically easily biopsied with just our ultrasound guided biopsy, but there are also some cancers, particularly up in this anterior portion, that are much harder to reach with just a typical ultrasound biopsy. And so by using MRI, we actually know exactly where we need to biopsy,
Wow.
and so we can go directly to that area.
That's amazing. So how would someone know that maybe this is what they need to get done?
Well, a lot of patients may be plugged into a urologist already. Typically, those patients may come and see me for a second opinion, or just to make sure that they feel comfortable with their treatment plan, or they may be patients that I've been following for years who now have a spike in their PSA, or there's some patients who have had multiple negative biopsies who still have an elevated PSA. We can do the MRI and provide reassurance. Hey, it doesn't appear that there's anything suspicious on MRI. We can feel pretty good about not proceeding with another biopsy.
Right.
Or if there is something suspicious that's particularly in a very difficult to reach place, we may be able to move ahead and go ahead with one of these MRI ultrasound fusion biopsies.
Now, does the patient have to be under to do this?
We typically do this under sedation because it does take about 20 or 30 minutes, because we initially obtain ultrasound imaging in the operating room, and then we fuse the MRI and the ultrasound images together to be able to do the guided biopsy of that area.
Wow, that's awesome. Dr. Spencer, thank you so much. Thank you so much for showing us this tremendous new thing, the technology that they have here at Singing River Health System. And again, go to your urologist. They recommend you for this. You can get in contact with them, and you can find out more information, of course, going to the website of Singing River Health System, because they are stocked full of all kinds of great technology that you will find very interesting to help your health.